But if you think we can get started, let's get started. Okay, I'm going to share my screen. Please let me know if you can see it. Share the
You're good,
agenda for the. Thanks, Samantha. So here's the agenda for the day. It's we are going to look at the PM Office, the application itself, for the first 5 minutes or 10 minutes, however long it takes. We'll reintroduce the PM Office to this group, fully realizing that most of the some of you at least have seen PM Office before, so please be patient, and because it might be new for some other users. And then we'll look at different encounter types that are available in within PM Office. And while I'm showing you different encounter types, I'm going to also focus on how can these conversations or encounters can be accessed from other applications outside of PM Office. Then we're going to go a little bit into the detail about the encounter. So just because we don't have a lot of time to focus on each and every encounter, so I'm going to focus on the most commonly used encounters, such as inpatient, outpatient, ED quick reg, ED full reg. And while we're also talking about these, I'm going to basically spend a few minutes discussing the difference between a conversation and the encounter or the patient type, because you might hear those words, and there is a there's a technical difference. I mean, doesn't not from the workflow perspective, but there is a difference what a conversation is versus what an encounter is. And then we can talk a little bit about the agenda for the next meeting, and then focus a little bit on Q&A. And then I think Tammy is going to take over. Samantha, is Tammy going to speak to the last two agenda items, or the question and answer and positive messaging? Okay, so
she's going to do that. She'll just be a little late joining.
No worries. Tammy's from the change management group, I think. And she's going to focus a little bit about different change management activities and how to manage different questions that you may be getting from within the organizations, and any positive or negative comment that you may be hearing from your side, how to respond to those. Okay, so let's jump in, and I'm going to share my. I'm going to open up the PM Office. So how to access PM Office, first of all. So PM Office can be accessed through the app bar. So here's the app bar. When you log in for the first time, depending on your access at the storefront, you may see several different applications on your storefront. The PM Office so I'm in the CERT domain right now, but if I open the production domain, it's going to be a little different. You won't see as many icons as you will see when you try to access non-production domain. So in the production domains storefront, these are probably the icons that you will see, or depending on your access, there might not be all these icons, maybe a subset of these icons, but you will see app bar, the first icon. So that is where you access the PM Office. So when you open PM Office for the very first time, it's not going to look like this. Sorry, the app bar. Let me just shut down my windows. I apologize, I have way too many windows open. Okay, so this is not what your app bar is going to look like. When you open it for the very first time, the app bar will be like a white strip up top on your screen. It will be kind of stuck to the top of your screen. Yeah, it's going to cover the whole length of your screen, and what you will have to do for the very first time, that you will see this A icon. You click on A. First thing is float. where you click on float. So it's not kind of stuck at the top of your screen. You can move it around. The second thing would be you have the ability to either say large buttons or small buttons. I prefer smaller, but we'll look at the difference very quickly. The second thing is that you go to customize after clicking on A, and then go to buttons, and then you will add the application. So within these applications, there's Access Management Office. That is essentially PM Office. That is the registration application. So it may be called a little different, but that is what is PM Office. So the names are kind of interchangeable, PM Office or Access Management Office. So just look for Access Management Office, and then there are other applications that you can add based on your access. If you're able to access Access Management Office, you're probably able to access Conversation Launcher. You can access Scheduling Appointment Book and PowerChart. Those would be most used application. There is another one that is useful, that is Documents. Again, I don't want to go too much into detail about the app bar. But yeah, so you will select those applications and you just hit OK. And then after that, once you do your initial setup, this is what your app bar should look like. It will say P2087, depending on the domain that you're in. If you're in the production domain, it will say P as in production 2087. I'm in the cert domain right now, so it says C2087. Okay. So the icon for Access Management Office or PM Office is this one. Let me just make it larger so you can see it. So quite a bit of a difference, significant difference in the visibility if you do large buttons or smaller buttons, but it takes more real estate on your screen. So difference. So I can click on Access Management Office. Take that up bar, move it to my other screen. Okay, so this is what the Access Management Office looks like. This is the basic interface of the application. You have your basic menu items up here. Then you have some logos or buttons in here that launch different sub applications from PM Office. So it really depends on your role, where you're going to be for most of your day. If you're going to be spending a lot of time in scheduling, or you're going to be spending a lot of time in PM Office, again, depends on your role. There are differences of what you can access from scheduling versus from PM Office. In the outpatient world, if you're strictly inpatient, then you're mostly going to be in PM Office and capacity management. You can access Scheduling Appointment Book from this icon up here. And then this is the basic layout of this application. So from the very first tab that you see is called Conversations. And then the second one is the bed board. You can see the bed occupancy in the bed board. There are work lists, so different work lists that will allow you to do some of the things that you want you have to do during operations. This tab, depending again, there's nothing in this tab really. This is for revenue cycle. Revenue cycle is a completely different suite of applications offered by Oracle Cerner, but they're not offered in Canada. And then you can create certain groups, and we'll get into groups. What are groups and what are they used for? So let's go back to the conversations. Okay, so this is where you access. These are all the available conversations to you, with conversations allow you to create certain encounter types. So the most common one, if your focus is outpatient, your most common one would be pre-reg and OP ambulatory registration. So those would be our most common one. Pre-reg and OP ambulatory registration conversations allow you to create a pre-reg and outpatient encounter, but also allows you to create a pre-recurring and a recurring encounter. You won't see a separate conversation that says pre-recurring or recurring. Okay. Ignore this for a second. That's a completely different, that's a different conversation for a different purpose, and we'll get to that. But to create a pre-reg, you always access pre-reg conversation. And then from the conversation itself, if the pre-recurring is available for that location, you will be able to select pre-recurring. Similarly, for outpatient ambulatory registration, this is the full registration. You create a pre-reg and then you do the full registration for the patient. Upon their arrival, you go into this conversation, depending on what your workflow is. You can either do that from scheduling or you can do that from PM Office, differences in roles and workflows. But to flip that pre-reg into a full outpatient encounter or change that pre-recurring into a full recurring encounter, this is the conversation. So that's why I wanted to clarify there's a difference between encounters and conversations. Okay. And you can see that I have access to most conversations in here. So I have access to all encounter types. I'm logged in as a DBA for now, just so I don't have to flip through the different positions to show you all the encounter types. But depending on the position that has been assigned to you or to your staff, you will see a subset of these encounter types or conversations. So if you're not in the women's health area, if you don't have the women's health clerical position, you may not see these women's health conversations. Bed transfer, family relationship, quick reg. And any of the ZZs, please just ignore them. These are going to be inactivated. You won't see them on the front end. These are mostly, we use these for testing. Okay. So any questions before I move forward? So that's the basic layout then of the conversations tab, then the bedboard. In bedboard, you can see the bed occupancy. You can go to, for example, Brockville here. I can see that these are the inpatient units where there are beds. I can click on it, double click on it, and then I can see what's the status of the bed, what is the room number, bed number, which patient is assigned to that room, some patient information. So it's a quick, and then you can right click and there are some actions that you can take. So if you go into conversations, you can probably even discharge your patient from here. The same idea, you have different facilities listed, and then from within the facilities, you can basically see different inpatient units where there are beds. Cindy?
Saad, where you're able to right click and discharge a patient from the bed board. If there was, let's say there was a discrepancy in admission time or something like that, that you needed to go in and change the admission time on it, can you do, or the discharge time, is there a way that you can edit the discharge or admission time from here as well?
So if you can access those conversations, so discharge encounter, so I can access discharge encounter, this one. You can access it from the right click there. If I can access modifying, is there a modify discharge encounter? If my position has access to it, then yes, I can directly do that from right click conversations. And right here, since I have access, but I do have, want to clarify again, I do have DBA access, so I have access to most conversations. But depending on your role and profile, you will have access to different levels of conversations. But you can definitely access whatever you see here. You can access that by directly right-clicking and then clicking on one of these conversations. So you don't have to search the patient. You're already focusing on a patient and then going into their active encounter or a discharge encounter.
Okay, if it's an active encounter with an admission time that needs to be modified, and I'm only asking because for Personal Falls, our reg clerks also do the admissions, discharges, and transfers. So I'm hopeful will have access to that. And if there was ever, for whatever reason, a time in the admission that needed to be updated, are they able to do that through here as well?
Yes, they can. And they should have access to inpatient registration. You can access inpatient registration directly from right-clicking and clicking on inpatient to modify their admit date and time. So that
Awesome.
position will very likely have access to, or will have access to capacity management for those different admissions and discharge or transfers, but they will have access to PM Office and all these conversations as well.
And they can essentially do it through PM Office through the bed board, the same as through PM Office, Catman, right?
Right.
Okay, thanks, Todd.
Do you want to add admissions transfers should initiate from capacity management, because there is a work list that gets populated once the patient admit order or patient transfer order is entered by a clinician. PM Office doesn't necessarily have that list because you also have to assign a bed, see the bed availability, assign a bed in capacity management, request a transport, and then look at that list and then access your admission or inpatient conversation through capacity management. Although it goes into PM Office, like it will still access the conversation from PM Office, but that's another route that you're going to take for admissions and transfers. But just so you know that it is all accessible from the bed board as well. Okay. Any other questions? Okay. Just considering the time, we'll go through work lists very quickly so I can show you a little bit more detail about the encounters or most commonly used encounters. Accommodation mismatch, this work list is mostly going to be used by the finance team if there is a mismatch. So if patient requested A and they've been assigned B accommodation, this work list will populate and then they can do whatever they need to do. Day surgery greater than 24. Again, you're not going to see each and every work list. Some of these work lists are not necessarily active or not available for every user. You will see a subset of them. But again, since I have PBA, I can see all of them. And as with the conversations, please ignore any Z or ZZZ or ZZZ. Day surgery encounters that are open, active for longer than 24 hours. So day surgery encounters don't automatically discharge like outpatient encounters do. So you can manage those work lists from this list. So once you click on any of these work lists, this is the basic thing that you will first have to do. You'll have to define which facility you want to focus on. You can't just select one unit. You can select a facility though. So if I was KHSE, I can either select Hotel Dieu, or I can look at KGH, or I can look at Bacon Community. Same thing with LAC. It's different facilities within the LACGH location hierarchy. I will select the whole facility. Again, I can't focus on one single unit, like a day surgery unit. So if there were any open encounters, open day surgery encounters that have been active for longer than 24 hours, you will see them here, and then you can close them out, discharge them by right-clicking on them. So all of these lists are actionable. You can, any entry that you see, you can right-click on them and action on them. As you can see, I can kind of have two work lists open at the same time. Okay, so first half will have one work list, whatever I opened first, and then the second one will have the second one that I opened. You can close it if you want. I can close this and just have this open, but just to just for convenience, if you want two separate work lists where you're comparing some things, you can have two work lists open like that. The directory unverified. So this one is another one. When we look at some of the encounter conversations, there is a field in the encounter where patient can select if they want them to appear in display directory. So display directory is essentially patient locator. That is a tool that that is not necessarily in PM Office. It is a separate tool. Patient locator is essentially something that can be used by switchboard. So all that field does, display in directory, is either hides the patient in the patient locator, or it shows the patient in patient locator. So more kind of privacy. Incomplete admissions are any encounters that are still sitting in a pre-admit state. And if there were any at Brockville, I would see that there are pre-admit encounters that don't have the complete admission yet. Same thing with women's health. So if there are any women's health quick reg encounters created, but they still have to be fully registered, here this will be the work list. Interpreter required. If within the encounter you say that this patient requires an interpreter, so anywhere within the site, within the facility, anyone selects when they're creating a booking, let's say, and they create a pre-reg, and within the pre-reg they say the patient needs an interpreter, then this list will be populated. Leave of absence is pretty self-explanatory. Any patient that you put on leave of absence will populate in this list, so you can manage them, and then you can take them off leave of absence once they return to the facility. Non-OHIP patients, so any patient that has any other health plan associated to them other than OHIP, this list will get populated. Expiring health cards. So this, I think, gets populated if the patient's health card is about to expire. I just can't remember what is the timeline, like how soon does this list get populated? Kaylin, do you remember at all? I think we had this discussion, but I just can't remember anymore.
I believe it's 60 days before. I thought so. Maybe I'm wrong.
I think you're right, but again, we'll confirm this, but it's between 30 and 60 days. If the patient's health card is going to expire in the next 30 or 60 days, this list will get populated. We'll confirm what the exact timeline is. Can't remember now. But as Kaylin said, I think it is 60 days. Okay. Positive arrivals. So positive arrivals are most for any encounter. So when you do an encounter, when you're creating a pre-reg or a pre-recurring or any of the pre-encounters, you select a certain arrival date. Mostly for pre-regs, I think. You select a certain arrival date. That patient was supposed to arrive on this date. Now, if that date has passed, there were patients who were supposed to arrive today or yesterday, but they haven't arrived, this list will then get populated that they were either you action on them, you follow up with the patient, why didn't they arrive? Or maybe they did and full registration didn't happen. The patient didn't get checked in. So this is the work list where you can manage those. Pre-admits are any open pre-admits. So pre-admits are any open pre-admits. So whatever pre-admits you have open on your patients, this is what will show. But I think, sorry, going back to the incomplete admissions, this list will probably show the ones that have a patient admit order on them, on the encounter, on a pre-admit encounter. I think that is the difference, but I will validate. So pre-admits, any open pre-admits, incomplete admissions, any pre-admits that have an active admit order. or a plan admit order. We'll confirm what is the criteria. Primary self-pays. So any patients whose primary health insurance is set to self-pay will get populated here. Again, something that the finance team will use. Recurring encounters reviewed greater than 120 days ago. So these are open recurring encounters that have not been touched or reviewed in the past 120 days. So as you know, recurring encounters don't automatically get discharged. They stay open, they stay active indefinitely until someone discharges them. So any encounters that have not been touched or used, recurring encounters 120 days, something for you to follow up on. Maybe the patient has truly been discharged, but the encounter wasn't discharged, or for you to investigate, is this really an active patient anymore even? Today's expected arrivals. So this work list is mostly for the outpatient world, where this will get populated when the patient has an active patient has a pre-reg encounter or a pre-recurring encounter, and they're supposed to arrive today. So it will always be today, it will be the current day. So this work list does not allow you to change the day, because as in the name, this is for the current day. And then unavailable physicians is essentially when you're opening an encounter. In the encounter, there are various physician or provider fields. You have admitting physician, you have primary care physician, you have ordering physician, you have referring physician. So in any of those physician fields, if you say unavailable physician, what that means is that patient does have a physician. So in case of primary care provider, for example, patient does have a primary care provider, but that primary care provider wasn't added as a patient record in our regional system. In that case, they will enter unavailable physician. What that does, it opens up additional fields, and it will allow you to manually enter the physician's name, as much information as a front-end user as you can put, maybe their last name, their first name, their address, and CPSO number if you know it. And then system will automatically populate that entry into this work list. Those are all the work lists. So we can look at some of those work lists in some of the next sessions, but that is essentially how these work lists work. I will confirm about the incomplete admission. Is it only showing the patients who have an admit order on them? And we'll confirm the expired health cards, if it's 30 days or 60 days.
Thought it was 30, and we actually changed it to 60.
I think there was a request by finance, by chart services.
Yeah.
Okay, so
So
there
it's
you
60
go.
days.
1 day. You have one answer. Thank you, Kaylin. So it is 60 days. It was 30 days, and then chart services requested to change that to 60 days. So any health cards that are expiring in the next 60 days will get populated in this work list. Any questions before I jump into, I'm going to look at 3 different types of encounters. Well, I'm going to focus on 2 encounters for today because we want to leave some time for Tammy to do her presentation. Any questions for now? Okay. All right. So actually, you know what? I'm going to focus on 3 conversations because they are important. They're the most used ones. Add, modify, person. So add, modify, person is not, it is a type of a conversation. You're kind of conversing with the system. It does not create an encounter though. Add, modify, all it does is creates an MRN number. So if I was adding a patient, for example, you can add a new patient record or modify an existing patient record through add modify person. I do have a test patient use. Test. Okay. So here's my test patient, ZZZ test, KHSE sketch A. So I can look for my patient. If there is a patient that you want to add, but not the encounter, you can look at, you can try to find a patient. Always, of course, use the health card number to search for the patient. Or if you don't have the health card number, you can use the last name, first name, add some additional patient identifiers, like maybe the sex and the birth date to find the patient record. Once you find the patient record, or if you don't find the patient record, you can click on add person. And in this window, you have to select where are you adding this patient record, which facility you're adding this patient record for. In this case, let's do KGH. This is where you'll enter the birth sex. So admin sex will default in from birth sex, but you can change it. Those are the options. And the birth date. And then the health card number. If you have the health card number when you're creating the patient record, do put in the health card number. If you don't have the health card number, you just select no in this field, and the health card number will become not required. So eventually, this is where you can also do health card validation. You can do it from encounter conversations as well, but you can also do it when you're adding the patient record. So up here is the icon for health card validation. I mean, it's not set up right now, but system will look at the ministry's database and try to pull in the information. But obviously, you need to put a health card number to do health card validation. Film probably would not work right now. Couldn't work. Yeah. Okay. And then here's where you can put in the release of information, consent granted. That's always defaulted to consent granted for HIE. By default, patient is opting out of fundraising. You can change it. And patient experience, opt out, sending them surveys or something. You can, but again, by default, it's no, but you can change it. Then you're going to add the patient address. And then the phone number. Now, you have the ability to skip this field. I definitely don't want to encourage to skip this field. If you have the information, enter it. But if you don't have the information, you put no phone, and then these fields will no longer be required. Same thing for contacts. Just looking at the time, I'm not going to fill these out right now, but this is where you can enter patients' emergency contact, maybe their additional contacts like next of kin, their guarantor, and then the alerts. If there were any alerts entered on this patient, then you can view them here. You cannot add any process alerts here. There's a different conversation for that. So once you fill out everything that you want to fill out, you hit OK. And all this conversation does is create a medical record number. It does not create an encounter. You can have multiple medical record numbers. So one for Kingston, another one for LAC, another one for Quinty. Okay, so that's the add modify conversation or add modify person conversation, where you can modify the patient record. You can mark them as deceased as well from add modify person. That's actually where you will mark them as deceased. Don't confuse that with deceased registration. That is for for autopsy, to register patient at KHSC for autopsy at the morgue. So don't confuse deceased registration with registering or changing the patient status to deceased. That is done through add modify conversation. The next one I want to quickly touch on is the inpatient registration. So inpatient registration, as by name suggests, you can, if you're admitting a patient, this is a conversation that you're going to use. There are different workflows. So the workflow normally, if it follows the planned admission workflow, then patient is there's a pre-admit that is created first of all. Once you receive the information from the receiving facility, you create a pre-admit, and then you basically get the physician to enter admit order. That admit order gets populated on work list within Capman. From Capman, you access that work list, you look at the patient, you pre-assign them a bed and a room before they even arrive. On the day of arrival, you go to the work list, you do a full registration. That full registration is still the inpatient registration. You're accessing it from Capman, but it is this inpatient registration. So I'm skipping the pre-admit part. Pre-admit is just a subset of the full inpatient registration. It requires less information versus a full registration. But for time's sake, I'm just going to focus on the inpatient registration for now. So let's take a look at. Now I've created a duplicate patient with the same name but different information. So truly not a duplicate, it's just the same name, but their health card number is different, birth date is different. Okay. Created that. Anyway, so once I find the patient, I preferably always use the health card number, because technically you can select the wrong patient, but if you have the right health card number entered, you will only see one entry, which will be the health card number that matches this patient. Okay. So the next thing, again, whenever you access any conversation in here, the system will ask you which facility or which organization do you want to create this encounter for. So again, so I created an MRN number for Kingston. So you can see there's a lot more tabs versus the add modify conversation. In pre-admit, you will basically see most of these tabs, but within these tabs, there will be not all of the information will be set as required. First required field is primary care provider. You enter patient address. If it's already entered from a previous entry or from a previous visit, from previous encounter, or from just add modify, all of this information will be entered, as will this up here, patient demographics. Risk questions, then the LIN questions, all of the fields that you see in yellow are required field. This is where you select if the patient consents for Healthy Life access. Now, Healthy Life is only going to be released for a very small subset of services as like a pilot program. None of the fields in any conversation are required. The Healthy Life fields are not required. So mostly you will skip this field or tab. This is where most of the information is captured, the encounter information. So you'll select which unit are you admitting this patient to. Column 5. So you already know from capacity management that you've assigned a certain bed for this patient. And now that you do, you can just click on bed availability, assign them that bed. Accommodation reason. What we have heard from shared services or finance teams is always start by putting in hospital convenience. And preferred accommodation is essentially what the patient requested. for accommodation reasons, start with hospital convenience, and then this will essentially populate that mismatch accommodation field, which will then can be looked at by the finance team. Next is the patient type. This is where you select inpatient. So for medical services based on the location and the services available at that location, there is a subset of medical service that you can select. So in this case, newborn or obstetrics. For whatever reason, I wanted to select a different medical service. I can say off service, yes. What that will do is open up all the medical services available in our system. So for some reason, you're admitting a cardiology patient, this as an example, cardiology patient on a medicine bed, you could select it by saying off service, yes. By default, it will be no. And it will just be these conversations that are code value grouped for that location. And we're going to talk about code value grouping in the next session. Similarly, bed service, you can select the bed service from this dropdown. So once I select the service, so which is newborn, bed service field will get shortened. We'll only see a subset. Again, that is part of the code value grouping. And finally, reason for visit, admit type. If it's a newborn, elective, scheduled, stillborn, emergent, urgent. Admit mode if it was ground ambulance, air, or combination of air and ground ambulance or no ambulance. Admit source, where did the patient come from? Day surgery, clinic, direct admission, emergency. If it was a transfer, transferred in, and where you select where was the patient transferred from. And display in directory, unverified is what, if you select unverified, that will get populated on that work list that we saw, which will, that you can go back and either say select yes or no. This is where you can put an encounter flag as well. If it's a patient, inmate, or if it's reveal no information, you put that flag in. Then select attending, admitting, and then there are all of these fields that where you can select the patient's information. So in contact. So when you're doing a pre-admit, these fields will not be required, but they are required when you do an inpatient. Although you can fill out those fields. If you have the information at time of creating pre-admit, go ahead and fill out those fields even though they're not required. But they will become required when you do an inpatient registration. Primary insurance. So this is where you're going to select patient's primary insurance. So subscriber, if it's self, if it's their spouse or aunt, brother, and what is a health plan. This is where you're going to select various health plans. Select OHIP, I can put self-pay, Canadian resident self-pay, out-of-country self-pay, manualized self-pay. So all the plans that are built in the system will be accessed through plan name. Now you can enter multiple insurances for the patient. So for example, if it's WSIB, then your primary may be WSIB, and then you still want to note down their OHIP. So you can put primary as WSIB and secondary as OHIP. And you can put primary and then 1, 2, 3, 4 additional insurances. And once you select all the insurance plans, this is where you can see a list view of different insurances that you have entered for this patient. If preemptively you wanted to add 2 different insurances, and then one is primary, but it's going to end on a certain day, you can do that. You can put in just put in an insurance plan. Right. We'll look at the insurance summary tab in the next session, but this is where you can say when does this insurance end and when does the next one kick in or next one starts. So we can liquidate. This is something that the finance team is really going to do, not something that I don't expect that the registration staff is going to do something like this. This will mostly be managed by chart services or finance teams. I wish we had more time to go into outpatient ambulatory registration, and maybe even look at some of the ED quick regs and ED complete reg, where we'll focus on the additional different encounter types and conversations in the next session. So agenda for the next session, we're going to continue discussion on the conversation types. If time permits, we're going to talk a little bit about code value grouping. What is a code value grouping? And then, well, that will actually take most of our time just going through different conversations and talking about code value grouping. Apologies, Tammy, it took more time than it was assigned to me, but please go ahead.
So Tammy actually can't join. I did post it in the chat. We're just gonna postpone those topics to the next meeting.
Sounds good. Okay.
So you can keep going for a few more minutes if you'd like.
I want to stop here and then first ask the group if there are any questions. Okay. So we can look at the outpatient ambulatory registration. That's another conversation. That's a main conversation that you will use to create outpatient encounters or recurring encounters. So similar to inpatient journey, starts within pre-admit, or may start from an ED. Patient is in ED, patient has to be transferred to an inpatient unit. That's another way. But if it's planned admission, then it starts with pre-admit, then goes into inpatient conversation. So that's the most basic workflow. Similar to that, in outpatient, when appointment is scheduled, at the time of booking the appointment, the staff will create a pre-reg encounter or a pre-recurring encounter. Now all of that happens in scheduling appointment book in the other application. You don't have to come to PM office to basically create a pre-reg. Now, if it's just a walk-in where you just have to create a pre-reg or an outpatient encounter, there is no booking. You're gonna have to go into, you can come into PM office and create the encounter that way. If it's DI, for X-ray walk-ins, for example, or any other walk-ins, that's DI quick reg. But if it's not DI, then just a walk-in, then you can create pre-regs, or you can just go directly create an outpatient. You don't even have to create a pre-reg for walk-ins. But if it's a scheduled appointment, the process is that you book the appointment, you add a pre-reg encounter, and on the day of the appointment, patient arrives, patient stops at the desk, either it's at the unit or it's at the central reg, however the setup is. Patient gets checked in. And again, that also happens from scheduling appointment book. From scheduling appointment book, you can create pre-regs, you can create pre-recurrings, you can do a full registration by following the check-in workflow. But if you're not doing it from scheduling, you can do it from PM office, okay, where you can create a pre-reg and then you can do a full registration. But wherever you do it from, you either launch this conversation from scheduling, you launch that conversation from PowerChart, you launch it from Conversation Launcher. It's the same conversation at the end of the day. It is a registration conversation. So that's what I'm going to show you very quickly, what that conversation is and what are some of the required fields. Use my existing patient. I'm creating an outpatient encounter. Okay, so similar to inpatient, you will see the same tabs in the outpatient conversation. There's a difference between the fields that are within these tabs. And really the only difference between inpatient and outpatient from information and from tabs and the fields perspective is within this encounter information tab. You see it's not as much yellow on the screen as it was for inpatient. It requires more information for inpatient versus outpatient, less information. But you start by putting in the unit, the outpatient unit where you want to register the patient. So select Cancer Center, KGH. And the patient type. So if this location was code value group to have outpatient and recurring encounter, you will see both encounter types available here. Same thing for day surgery. This is where you create the day surgery encounter as well. So if there was a day surgery encounter associated to that location, you will see that option in this dropdown. So day surgery encounters also kind of start their journey from a pre-reg. Pre-reg goes to day surgery, pre-reg goes to outpatient, but pre-recurring goes to recurring. Pre-reg, you can start with a pre-reg, you can change it to a recurring encounter, but if you already know this is going to be a recurring encounter, start with a pre-recurring encounter. And select outpatient. For oncology, it will most likely be a recurring encounter. And visit type, is it a face-to-face? Is it home visit? Is it research, telephone, telemed? And medical service, again, depending on the location you select, you will have a limited, you'll have a specific medical service. So unlike the inpatient conversation where you can change the medical service by selecting off service option, you don't have that option in outpatient registration. And this is part of code value grouping build. Again, touch upon that later. And then reason for visit, display in directory, same idea for display in directory. You want to show the patient locator. And an encounter flag that you may want to add, the attending provider. Now, while I'm in here, I can show you what that unavailable physician does. So if I put unavailable physician it won't necessarily use it for attending. If it's an attending provider at the site, they should be in. Shouldn't use this example. Use primary care providers where probably you'll have more instances of unavailable. You put unavailable in here. And now I can manually enter some of these fields like the last name, first name, phone number, CPSO, address, city, any information, as much information as you can provide. This will then get populated on that work list. Okay. We select the attending. The attending is always the required field. One thing I want to add very quickly in the attending, and I think there have been questions around this. Now, there may be an instance in the outpatient areas of services where there is truly no attending provider. Okay, because it's a nurse-led clinic, or if it's a social worker, allied health-led clinic, physiotherapy, there is no attending. There is an option where you can put provider unrequired, or provider unrequired, or unrequired provider. Provider unrequired, last name is provider, first name is unrequired. So you can put that. So that is essentially used to skip this field because the patient truly does not have an attending. Unavailable physician is not the same as provider unrequired. Unavailable is that the patient does have a physician, but they're just not built in our system. Unrequired is truly that the patient does not have a physician. Okay. So we're almost 2 minutes. I want to quickly go through the rest of the fields. They're no different from the inpatient encounter. So in contacts, you have emergency contact, your next of kin, guarantor, And with primary insurance, same thing with primary subscriber, you select a health plan. And similarly, you can select up to 4 different health plans in addition to the primary. And then insurance summary is where you can see the list of all the insurance plans that you've selected in these tabs. If you're wondering what this button does up here, if you click on this button, this is where you can scan the patient's documents, like paper documents in, depending on the workflow. If you have document scanners at the desk, and it's going to be the red staff who's scanning these documents in, they can. If your workflow is that all the documents get sent to health records and then they do a bulk or a batch scan, then you won't really use this this application document image. Just continue sending whatever your workflow is, but you can access images, so you can store those documents on that specific encounter. Anya.
I'm understanding that that workflow will store the document differently than the health records workflow for release of information. Is that true?
I'm not sure, Anya, if it's going to be different. All I can say is that what truly is what it's doing, you're scanning and you're associating this document to a certain encounter. If there are separate documents created in the backend, I'm not aware of them.
Okay, because it was explained to me that at registration, what would be scanning would be things like copies of insurance forms and things like that. And that those wouldn't be part of when you do a release of information. So we really need to understand what these different flows do for images.
We can contact the
You may want to talk to
HIM
Brianna
team.
because that's where I heard it.
I'll talk to
Brianna
Starlina. I'll talk to Starlina, the workflow lead for HIM, and I'll confirm with her what
Thank you.
if there is any difference. But yeah, thanks for pointing that out. Okay, we're 1 minute over. Any questions? So the agenda for next week is we'll focus on some additional encounter types, and we'll, if time permits, we can also look at code value grouping, the concept behind code value grouping, and also any questions or anything that you want to add to the next meeting. The agenda is not necessarily set in stone. We can change it depending on if you have any questions or if anything that you want to talk about in the next meeting. So let us know. Hey, thank you so much, everyone. And we'll talk again soon.